Well, we of course have many blood tests that we've been using for years to look at the kidney function test, liver function test, even tumor markers that tell us how much tumor there is. But what we haven't been able to do is look at the genetics of the tumor, looking at the DNA. And we know that many cancers have alterations in the DNA, some of which can help us determine what therapy to use. For example, amplification of the HER2 gene tells us that we can use Herceptin and that it will be a useful drug for that patient. However, when patients' tumors progress, we know that the genetics sometimes change and we have to do another biopsy. And sometimes we have to do a biopsy of the metastasis, the liver, the lung. And there is not only a small risk of danger, but it's a very laborious and expensive test. It turns out that some of the DNA actually leaks out into the blood, but there's very small amounts of it. And so there's now new technology that allows us to detect these very small amounts of DNA, and now we can just do it in the blood without having to do a biopsy. So that is an important advance. But like I said, where we really have to make progress is understanding how to use these genetic abnormalities to make decisions. Now, in some other cancers, we're already doing it. In lung cancer, for example, mutations in a gene called the EGFR gene is used routinely, and another gene known as ALK. So in the lung cancer world, they're actually poised to do this already, and there have been recent approvals of blood-based biopsies in that area, and more recently for melanoma with mutations in a gene called BRAF. So the field is already moving towards liquid biopsies, and the breast cancer area will eventually be using these as well.